lately there's been celebrities that have had, kind of quote unquote deep plane facelifts. And so it's been very popular now, and I get lots of patients asking about that. And I do deep plane facelifts, and I do more traditional facelifts. And it really just depends on the patient and kind of what they're looking for, and it depends on their anatomy. With a deep plane facelift, you're going underneath the muscle and the fascia, and you're releasing some of these retaining ligaments in your cheek, in your mid-face, and then down along your jawline so that you can lift that as a composite flap. But not everyone's a great candidate for that, and so it really depends on the patient. And again, it's a popular thing to talk about now, and it's something I discuss with all my patients when they come in, and we talk about the pros and cons of the different types of facelifts and why I would do one versus the other. The thought is you'll have a longer lasting result with a deep plane facelift. Now there is controversy in that, and there's a lot of surgeons that'll say there's actually no evidence that a deep plane facelift looks or lasts any longer than more of a traditional SMAS type of facelift. When you do face and neck lift surgery, when it's done and it's done tastefully, they're going to look refreshed, they're going to look younger, but the vast majority of patients don't want drastic changes. They want friends or family to say, hey, you look great, you look like you're rested. And I think if that's the result, I've done my job. Facelifts are one of my favorite operations. I love the anatomy of the head and neck. It's very intricate, it's very detailed. You have to be very focused when you do that surgery. And it's out there. It's out there for the world to see, for the public to see, and so it's important that you do your very best job. And so I like the detailed nature of face and neck lift surgery. I also like the intricacies. And so you don't do the same facelift on everyone. And so we have all these tools, and with face and neck lift surgery, we get to use those tools. You have to look at each individual patient and look at where their problem areas are. Do they have excess, do they have drooping glands in their neck? Do they have a lot of fat in their neck? Or do they just have a little bit of sagging in their jaw? Am I going to address more of their mid-face, their lower face, or their neck? So there's just so many subtleties in evaluating their face. There's not, every face is different, and you're going to treat it differently.
So if you look at the average aesthetic plastic surgeon, which is a big difference from general plastic surgeons, they do about 15 to 20 facelifts a year, and I typically do right around 100 facelifts a year. So it's something I do a lot of, I'm very familiar with, and I'm very passionate about.
Facelift patients are a very happy group of patients. It's a very gratifying operation. They see this nice change, and they'll say, hey, I finally look how I feel. And ultimately, I feel like I've done my job when I've done that.